Bonjour Claire. Alors, je vais rentrer les gens qu'on connaît, qui sont censés être un peu en avance, comme Audrey déjà. Bonjour, bonjour Audrey.
Bonjour. Pardon, j'étais
Bonjour.
mutée.
Diana est en train de nous rejoindre. Ah, je suis désolé, je vous ai pas entendu, j'avais coupé le son.
On n'a rien dit.
Ah bon, d'accord, donc je pars dans le vide.
Juste,
Non,
juste
t'as dit
pour-
il y a Diana qui est en train de se connecter.
Bonjour,
Salut Diana.
Bonjour,
ça va?
bonjour.
Ça va?
Ok, Claire.
Alors,
En forme?
Oui, ça
Comment?
va.
Bon, on a bien eu les slides d'Audrey, mais on n'a pas eu les slides de Claire. Au cas où s'il y a un souci, on ne pourra pas partager. Pour le moment, si tu veux
oui.
envoyer Claire, on ne sait jamais.
Oui,
Ouais.
je vais les envoyer maintenant.
À Dylan et moi, comme ça, on est
Oui.
sûr qu'on a vos slides s'il y a un souci.
Pardon,
Hop,
j'ai
Il
oublié.
y a beaucoup de gens dans la salle d'attente.
Comment?
Il y a beaucoup de gens dans la salle d'attente.
Oui, déjà, il y en a quelques-uns. Je laisse rentrer la CCU là. Je vous donne à tous les droits de...
Bonjour à tous.
Salut Claudia.
Salut.
Salut.
Claire et Audrey en cohorte. Voilà. Je nomme la CCU en cohorte. Normalement, vous n'avez rien à faire, mais enfin, c'est juste au cas où il y a un problème. Ouais, d'accord? Ne vous inquiétez pas. Hop. Hop. Donc, à partir de 10 heures pile, je laisse rentrer tout le monde.
Oui.
C'était l'heure qu'on s'était donnée. Et là, je regarde s'il n'y a pas... Déjà, il y a 40 personnes. Normalement, vous voyez les personnes en salle d'attente, là.
Oui.
Alors, j'essaie de retrouver Jonathan s'il est déjà dedans. Oui, il est là.
Yes.
Alors, il ne faut pas que ça bouge. Hop, ça y est. De toute façon, il est 10 heures, donc on va...
Parti.
Ok, bon. Donc, tout le monde est là. Je fais accepter tout le monde. Vous êtes tous prêts?
Oui.
Ouais, je me suis
Ok.
casquée, mais du coup, ça fout mes cheveux en l'air. Mais je pense qu'on m'entendra mieux si je suis au micro.
Possible. Allez, hop. 3, 2, 1, c'est Darty.
La rafale. Okay, so it's 10:02. Dylan, I'm gonna let you let people in while I'm saying hello to everybody and welcome to the first installment of a series of webinars that is dedicated to the ISIDORE project. We are very pleased to see that there was a big interest in that webinar and getting some more information about the project. I hope that you hear me well. If you don't, please let my colleague know in the chat. They will make sure I'm also informed. This is going to be a very standard format, I would say. I will ask you to please, for now, not put your camera on. Also, stay muted until we open the session of questions that will be at the end of the webinar after all the presentation. This is going to be in two parts. I'm going to give you a very general overview of the project so that you understand very well the context of the ISIDORE project. And then my colleague Claire is going to present like the very real and logistical aspect of getting some support from our action. So I hope that everybody is ready. I'm not going to be able to see the chat while I am talking, so I was going to also introduce myself very briefly. I'm Audrey Richard. I'm the Director of Operation of the European Research Infrastructure on Highly Pathogenic Agents, which is an infrastructure that is coordinating the ISIDORE project. So, as I said, I'm going to give you an introduction to the project. If you don't hear me well, again, please let me know. I'm going to keep my camera on for now, but if there is any problem with my bandwidth, I will just shut it. So again,
just 1 second, Andrew.
yes.
We have several people saying that they have problems with hearing you. The sound is not very clear for them. Probably maybe you can turn off the camera.
Is it better with my camera off?
Yes, for the
Okay.
moment.
I think there are like too many people that are connected for my computer to really process everything. I'm sorry about that. So I hope that you hear me well now. Again, I'm gonna give like a very big overview with a context and everything and how the ISIDORE project was created. So this starts about 2 years ago, 2 years and a half ago now, at the onset of the COVID-19 pandemic. Back then, a lot of people were saying that that big pandemic was a big surprise, but actually in the infectious disease field, this was not necessarily much of a surprise. And it had already been anticipated that at some point there would be such a huge infectious disease event. And actually in September 2019, when the World Health Organization published the report from the Global Preparedness Monitoring Board, they did mention that high impact respiratory pathogens, such as an especially deadly strain of influenza, pose particular global risk in the modern age. In addition to that, this was not new in 2019 either. Some other people had already identified respiratory-borne RNA virus as high risk for global catastrophic biological risk threats to human health. So this was definitely expected, and also there were a number of infectious disease events during the 21st century. It started with, if I only talk about the 21st century, it kind of started with another coronavirus, SARS, the severe acute respiratory syndrome virus, in 22 and 24, if you remember, there was a SARS outbreak that already had a pretty big economic impact. The human losses were not as high as what we have now with the COVID-19 pandemic, but there was already like a fairly significant impact. In 2009, there was the swine flu pandemic. In 2012, another coronavirus emerged with MERS. In 2013, 2016, there was that big also epidemic of Ebola virus. And in 2015, 2016, if you remember, there was also the Zika virus epidemic that was also considered a public health emergency of international concern by the WHO. So definitely, even if there were all those events during the 21st century, things did not go well at the onset of the COVID-19 pandemic. We have observed an insufficient preparedness and response systems and capabilities for disease outbreaks to deal with the pandemic at a global level, and also including, of course, at European level. And there was definitely insufficient research and development investment for getting some vaccine development and manufacturing them. We have no broad spectrum antivirals that are ready to be used in case of a very significant infectious disease outbreak, no targeted therapeutics, lack also of evidence-based research for putting in place appropriate public health measures, etc., etc. So something definitely did not go well. At the moment of the pandemic, health management in the European Union was basically managed by two main agencies: the ECDC, that communicable disease threats, and the EMA, the European Medicine Agency, for scientific evaluation, supervision, and safety in the EU. Why did we try those elements? So what happened is that they have only mandates for communicable disease threats. They do not deal with any other health threat, and also are not in charge of development or production of medical countermeasures. For the EMA, they only manage medicines, so they do not do any medical countermeasure than medicine, and they do not take either of procurement, stockpiling, and discipline of capacity. So there were some mandates that could be distributed to another agency, and that's how the Emergency Preparedness and Response Authority was created. And now that agency has those additional mandates that, in addition to the ECDC and the EMA, has created a sufficient number of agencies to cover what has been called the Health Union. So
Audrey, just sorry for interrupting. Several people are saying that their voice is very bad. We don't hear you very well. It's cutting and becoming a little bit metallic. I don't know if you can manage to do anything from your side.
No, I don't think so. I have my microphone, so I'm already plugged. My voice is, I mean, my mouth is very close to the microphone. I think this is because there are a lot of people connected, and my my connection is a little bit saturated.
Not very good.
It's saturated now because there are a lot of people connected. Actually, I can try, and I'm just gonna try one thing. You'll tell me if that makes it better. I'm gonna
now
try
it's
to
a little
switch.
bit better.
I changed nothing. Can you hear me enough to understand what I say?
Now, yes.
Okay, so the Health Emergency Preparedness and Response Authority aims to strengthen Europe's ability to prevent, detect, and respond rapidly to health emergencies, and will ensure the development, manufacturing, and procurement of key medical countermeasures. One of the very first cornerstones of that new authority was actually the launch of a call for proposal that generated the ISIDORE project. So ISIDORE stands for Integrated Services for Infectious Disease Outbreak Research, and it is dedicated to supporting scientists and their research on epidemic and pandemic-prone pathogens, through the provision of research infrastructure services. So that you can do a project that will last 3 years. It has a budget coming from the community, and we are in position to buy the community, so provide you with access to over 300 services in very different fields. I will come back to that a little later. We have 53 partners in 32 countries. So we have gathered a fairly massive consortium to support research in infectious disease. The coordinator of the project, Arena, the European Research on Highly Pathogenic Agents, was created in 2017 as a non-profit international association, meaning that we have members. We have 10 members that are distributed throughout Europe, and we are dedicated to the study of highly pathogenic microorganisms. Our mission, especially to increase the understanding of diseases caused by highly pathogenic agents and the preclinical development and assessment of medical countermeasures. We have defined some priority pathogens in our research portfolio, and that include the priority pathogens that have been listed by the WHO in their R&D blueprint list of pathogen, and that includes filoviruses such as Ebola and Marburg viruses, as well as arenaviruses such as Lassa, Nipah and Endra viruses, CCHF, SARS-CoV-2 now, bacteria that may become highly pathogenic agents and as unknown pathogens. So we are, before the COVID-19 pandemic, we were already dedicated to epidemic and pandemic prone pathogen and their study. We have gathered a number of research infrastructures and networks to be able to build the ISIDORE project. They are listed here. We have gathered that way a very broad range of expertise. So in infectious disease with EVA, VetBionet, InfraVec, and TransVac. And we've also gathered some more general research infrastructure, such as BBMRI, ECRIN, EATRIS, Instruct, Eurobioimaging, EU OpenScreen, InfraFrontier, EMBRC, Elixir, MIRI, and Sonar Global is also a network that is dedicated to infectious disease and social science. And in addition to that, we have a national network, Emergen, that is dedicated to epidemic surveillance. You will have access to all that information, so I'm not going to list all the different expertise, but basically we are covering all the different topics that needs to be covered for research and development in the field of infectious diseases. The ISIDORE project has really two main objectives. It's about responding to infectious disease challenges and also preparedness. So we aim to contribute to fighting the rise of the SARS-CoV-2 variants. That's what we call the challenge-driven approach. And that's how we, the way we do it is by implementing emergency research response that is, in that case, dedicated to developing or adapting countermeasures and also developing evidence-based public health decision-making, etc. We have been facing a new challenge since the launch of the project about 3 months ago with the monkeypox virus outbreak, and we will come back to that a little bit later as well. The second main objectives of the project is to contribute to Europe's readiness to any epidemic-prone pathogen, because obviously we do not want the COVID-19 situation to happen again, and that's what we call our preparedness-driven approach. And what we want here is to support researchers and their project in the field of infectious diseases in what we call peaceful times, meaning when there is no infectious disease crisis ongoing. In that preparedness-driven approach, we will have a focus on non-SARS-CoV-2 respiratory viruses, RG4 pathogens, arboviruses, disease X, and any other pathogen of concern. Really, what we really want you to, the message that we really want to convey is that our primary focus is user needs, and by user, I mean scientists and researcher, and so therefore you. The scope of the action. So as I said, we are dedicated to pandemic preparedness and response with a One Health approach, and including also social sciences, because that has proven very crucial during the pandemic. I can hear a lot of background right now. Okay. In addition to that, we will conduct our action through the provision of research infrastructure services to scientific communities through something that is called transnational access. And I will come back to that to explain to you if you're not familiar with the concept. What we will support is research that is aligned with the priorities of different agencies, including HERA, the European Commission, ECDC, WHO, CEPI, the EMA, that I already mentioned before, FPIA, WOAH, formerly OIE, FAO, and GLOPID are so major player in the field of infectious diseases and pandemic management in general. We also have a focus on data management because we want to make use of global standards and common data platforms for all the results that will be generated by the project and by the project that we will support for you. And for that, we will also cooperate with the consortium that was awarded for the topic Fair and Open Data Sharing in Support to European Preparedness, a project that is called By COVID and that we are very closely related to. The way we have built the scientific concept of ISIDORE is based on the research and development pipeline of infectious disease research. So imagine that you start from an outbreak. If you want to control the disease, you will need to go through a number of steps, including pathogen isolation and identification, pathogen characterization. We want also to characterize molecular targets. Basically, if you want to be able to develop countermeasures, there are medical, veterinary, you need a number of steps and a number of capacities we have to be able to cover all that research and development pathway. This will enable to support the response to an epidemic crisis and or increase to epidemic. This is why we have so many infrastructures, networks to be able to conduct the ISIDORE project. So about transport access. So this is something that scientists are not always very familiar with. So to give you an overview, basically in a usual funding model, there are some proposals that you as a PI or consortium respond to. It is meant to obtain funding that is directly provided to either the principal investigator or to the consortium, and in that case, they are the people conducting the research. In the case of the transnational access model, we have also a model with call for proposals, where scientists, or as sometimes we call them users, respond to those call for proposals. They submit project, but in that case, the funding is not provided directly to them. It is provided to research infrastructures so that the research infrastructures can conduct experiments for the scientists for free. So imagine that you do not have access to very specific capacities, either in your institution or in the country that you work in. That would be the way to get access to those capacities. Overall, this is how the ISIDORE project will be operating. So we have a strategic advisory board that gives us instructions for the research priorities that we need to support. Then the ISIDORE project designs and launch calls for proposal, and the scientific communities, meaning, again, we call them sometimes the users, but that's definitely researchers and you in the audience. You apply to those calls for proposals, and we have, in that case, again, independent. This is a very classic model in the end. We have independent reviewers that evaluate those applications. We select projects that describe some very specific experiments that need to be done to make the project progress, and the selected project will be implemented by ISIDORE partner facilities, and that's what is called transnational access. So definitely our ambition and what needs to be understood about the ISIDORE project is that we are here to support your research in infectious diseases. So now I'm going to go in more details in the calls for proposal that are currently open and that are available on our website, just so that you understand maybe better the way it's all working. So we have currently 2 calls that are open, one about SARS-CoV-2. This one will remain open as long as funding remains, and there are 21 topics, research topics of interest. We have 1 emergency call for proposal for monkeypox virus research. The deadline for submission of a pre-application is the 5th of August, and we have 18 topics of research. And just so you know, we will open new calls for proposal in fall and that will be preparedness dedicated calls. So they will be more focused on other pathogens that are and that will not be at that moment either, hopefully, an emergency concern, a PHEIC. As I said, we have a strategic advisory board that is giving us instructions and recommendation as to the research priorities that we should be interested in. I have already listed them, but basically what we wanted to gather is expertise in research and innovation, public health, medicinal products, vaccine, infectious disease responsiveness and preparedness as well. And we had also an interest in getting the opinion and the input of the pharmaceutical industry. All the calls for proposal will most likely have 6 sections. We will not necessarily open topics in all the sections all the time, but what we want to support is research on surveillance and epidemic risk management, regardless of the pathogen, understanding the pathogen or the disease and basically the natural history of viruses and any other pathogen actually, diagnostics, therapeutics, vaccines, and epidemiology and social sciences. So as you can see, this is all very classic, and we have topics, research topic in all of those sections. In the case of SARS-CoV-2, so those are the current topic of interest, and we expect your research project to align with one of those topics. So we have 5 of them in surveillance and epidemic risk management. Not necessarily going to list and talk about them all, but I want to draw your attention to those that we identify and flag as One Health topic. Those are the topics that really require a One Health approach. So they have been specifically identified. We have also topics in understanding SARS-CoV-2 and COVID-19 because there are still a lot to decipher about the virus and obviously all the variants of concern. So we have topics about the characterization of the newly detected variants of concern, the mechanism of the severe outcome of SARS-CoV-2, and that also include long COVID. Disease susceptibility in the context of co-infection is also of high interest in research, in infectious disease research nowadays, because definitely, for example, in the winter season, there are some, there is a possibility that people would get co-infected, for example, with the flu or with the cold, and it is interesting to find out what could happen as an outcome. We have also, obviously, some topics in the diagnostic section. So I want to draw your attention on the fact that we are now only supporting projects that will support the development of tools that are able to detect multiple pathogens. There is a decreasing interest in diagnostic tools that are only able to detect SARS-CoV-2 or are not even variant proof, but there is definitely now an increasing interest and focus on being able to diagnose several pathogens at the same time. So this is, for example, the limitation of this topic, and to be eligible, you would need to propose something that enables the detection of several pathogens. In terms of therapeutics and also in the vaccine section, you can see also that we have flags. So in I want to draw your attention that by that, we mean that you would need to choose that topic only if you want to get access to a clinical trial. So it needs to be associated with a clinical service. So just pay attention when you choose your topic. If you are not, intend to administer a new drug or a vaccine to patients, you are not with clinical topics, regardless of the future outcomes of your research. Maybe ultimately, your research could result in clinical intervention tools, but as long as you do not require access to clinical trials from ISIDORE, you should not pick that kind of topic, and everything else is considered pre-clinical research. In terms of monkeypox virus research, we are also covering the same sections. We have a number of topics under the surveillance and epidemic risk management. Of course, there is a big interest in One Health in the understanding transmission from animals to human and animal reservoirs. So we have a big interest in identifying all those animal reservoirs, especially potential European species that might be reservoir of the virus nowadays. Also, identification of the reservoirs endemic countries is not entirely clear. So any research project that would be in support of getting answers about that type of question is very welcome in the ISIDORE project. We have also topics on the natural history of the monkeypox virus. So the suffering host pathogen interaction, very high interest, monkeypox virus induced immune response, the virulence of the virus, including the role of the mutations, if any, and also any comparison of the clades will also provide some interesting answers to the current crisis. In terms of diagnostics, there is not the same requirement as for SARS-CoV-2. We are here interested in developing and optimizing those diagnostic tools, including serological one and also molecular one for human, but we will also accept proposal that would cover animal diagnostic for animal population. Most of the time when we are talking about animal population, we are talking about wildlife species or livestock. Anything that is like domestic is not within scope. In the case of the monkeypox virus, we have not opened any priority topics in the therapeutic section. The reason is that there is now a high interest in clinical trials for testing what already exists against monkeypox virus. There has been no need identified in developing new therapeutics and new drugs against a monkeypox virus for now. This is an ongoing situation. Depending on how things unfold, there will be also probably an evolution of the research needs on the topic, but for now we are not in position to support anything in the field of therapeutic development. For vaccine, the main interest is about the cross protection induced by vaccines showing efficacy against pox viruses and the duration of that protection. Vaccine efficacy pre and post exposure is also of high interest, especially for protecting people that have been in contact with a contaminated person. Also, the identification of biomarkers of protection is of high interest to be able to anticipate whether or not people are still protected if they have been vaccinated, especially a long time ago. And we have also a number of topics for social science and epidemiology, with especially an interest in, similar to SARS-CoV-2, it is interesting to understand what drives the vaccine and therapeutic uptakes in community groups. So in terms of future action, as I said, ISIDORE will be focusing future call for proposal on other pathogens. Hopefully this will be a whole preparedness approach. We definitely hope that we will not be covering yet another infectious disease emergency. So we expect to be launching calls for proposal on risk group 4 pathogens, respiratory pathogen with pandemic potential that are not SARS-CoV-2, arboviruses, and other pathogen with pandemic potential, and that can include disease X or any other pathogen. And I'm saying pathogen because this does not have to be virus. So our future action, just as the current one, will be aligned with the R&D blueprint and the pandemic response determined and defined regularly by the WHO. And as I said, those are our future action if everything goes as planned, but don't know if you have seen, there is no reason to expect a big event based on that, at least I hope, but just to inform you that there are always some new cases, new events that happen. So very recently in Ghana, there was a detection of a couple of cases of Marburg virus disease. So we keep an eye on all of those events, and should the need arise, we will also cover those new threats by launching emergency actions. But other than that, we will definitely focus on those 4 big categories of pathogen of pandemic potential in the next month. So by the end of 2022, there will be additional call for proposals. So that, before we turn to the session of Claire, the project manager, will explain to you everything that you need to know for getting support from the project.
Thanks very much, Audrey. I will just share my screen as well, so I hope you can all see that correctly. So as Audrey said, I'll be going through some of the more practical elements of the website, the range of services that we have, and then going through the process for how you can actually apply to these services. So just first up, if you haven't already been to the ISIDORE website, you can see the address at the top of the page here, and this is what the front page looks like. And when you go to this front page, you can see a menu at the top, but also down the bottom of this page. The calls for proposals part is what Audrey's already just been through. So at the moment there, we have the 2 calls for SARS-CoV-2 and COVID-19 and monkeypox. But later on, we will be adding to that. So feel free to check back, hopefully, as Audrey said, in autumn for future calls for proposals. And we also have the list of services that I will take you through. At the moment, this catalogue of services is only relating to the SARS-CoV-2 calls for proposals. It will be updated and extended as we prepare for future calls as well. So when you go to the catalogue of services, you will come to a menu like this. So we've divided the catalogue of services is generally divided into 9 very broad categories. These are analytical services, cell models, in vivo models, immunomonitoring and profiling, support for diagnostic and therapeutic development, support for vaccine development, clinical samples, regulatory advice, trial preparation and access to clinical trials, and also social sciences and epidemiology. So as mentioned, this is at the moment just relating to SARS-CoV-2. I'll mention the process for monkeypox in a moment. And I'm not going to go into a lot of detail on the specifics of these services today. You're welcome to browse through the website. And also there will be a number of service or category specific webinars that are being set up by some of the ISIDORE partners. So as well, we'll be sharing information about those webinars on our ISIDORE Twitter is probably the easiest way to keep updated, as well as through our newsletter. And when you go to these categories as well, you will see contact details for who is the lead contact and the best person if you're looking for specific answers to specific questions about the services that are provided. But today I'm just going to, as an example, look at the cell models category so that you can see an example of the range and the sheer number of different services that we have available. So when you go to the cell models, you will then come to a list like this. So this is the list of subcategories. And when you click on the small plus button on the right-hand side, you will come to the list of subcategories. So these are divided down in what we hope is a very logical way for you to be able to navigate and to search for the service which is most appropriate for your particular project and your particular experiments. Once you open up this, you'll see there's a contact details for the best contact. As Audrey said, we have such a large consortium. So these contact details will send you to the person who's best placed to answer questions about that specific service. And then again, these subcategories open up into a list of the very specific services that we provide. So as you can see, when we've got these 9 overarching categories, this divides down into hundreds of different individual services that ISIDORE is providing. So in terms of how to apply for ISIDORE services, I'll be going through in two separate application processes, one for the SARS-CoV-2 and one for monkeypox. But firstly, I just wanted to look at the eligibility criteria. This is obviously the most important part as a first step to make sure that you are eligible before you continue with your application. So just as a process point, you will need to complete a pre-application through the ISIDORE website, and that will provide you with an ISIDORE ID number. This ID number is essential to be able to access any of the ISIDORE services. Other eligibility criteria, transnationality. So as Audrey mentioned, this is transnational access. So what that means is that you are applying for access to services which are not available to you in the country that you work in. And we benefit from a very wide geographic scope within the ISIDORE project of approximately 32 different countries within the EU, but also outside. So you have access to a number of services outside of your own country. Affiliation. Now, I saw one question in the chat from Roya around this. Most of our applicants do need to be affiliated to an organization within the European Union. However, we do have some capacity to provide services to applicants from outside the EU. That's a maximum of 20% of the total access that ISIDORE is providing. And so that will be monitored throughout the duration of the project to ensure that we are not going over 20%, but applicants from the UK and from other countries outside the EU are eligible to apply, but just to be aware that there are some limits on that. We also ask that all applicants are able to disseminate the results that they will generate thanks to the support of ISIDORE in order to be eligible for this access. So that's also a really important part of the EU's approach to this around improving capacity more broadly, ensuring that results generated are shared for wider benefit for the preparedness of the EU and globally for coming pandemics. So specifically how to apply for the SARS-CoV-2 call for proposals. In general, this is a 5-step process. So the first step, Audrey has already talked through around reviewing the call for proposals and identifying that appropriate topic, the specific focus of your project, which matches one of our call for proposal topics. Then after that, you'll browse through the catalogue of services, as I went through just earlier, and you'll find the service which you are looking for. Once you're on that services page, so as I said before on the cell models, once you scroll down to the bottom of that page, you will see a pre-application form. So these 3 first steps are the centralized ISIDORE process. They're the exact same for every single applicant who is applying for ISIDORE services. So this pre-application form, if we go again back to the cell model service, the first question is asking for which subcategory. So in this case, which cell model. You'll notice that there's a note that if you are looking to apply for multiple services at the same time, whether that's multiple cell model services or whether that's services across completely different categories within the ISIDORE project, please contact us first and we will guide you through the most appropriate way of applying for multiple services at the same time. Once you've selected your category, it will open up to the specific subcategory and then the specific service. So you're selecting right down to the exact service that you are looking for within that larger list. We then ask for, it's a very short pre-application form, so we're asking for some very basic information here. We ask for your country of organization, that is to ensure that we are adhering to the transnationality requirements and to ensure that we're not providing you with a service which is inside your own country. And we also here ask for that TNA topic. So this is this list that Audrey went through before. You need to match up. These are so you can see SC 1.1 is referring to the SARS-CoV-2 topics, and you match the number of that topic from the list from the call for proposals. We then ask for an ORCID number. If you don't already have one, that's a very quick process, and you can see the link to apply just directly under there. So that should only take you a few minutes. And we also ask whether you're a private for-profit company or from academia or non-profit. Both of these categories are eligible to apply. It's largely for our monitoring purposes. We then ask for a very short description of the aim of your research. So you can see it's a 500-character limit. So it is a very short overview of what is your research and what's why you are applying for this particular service through the ISIDORE project. And then once you click submit, that's the pre-application process complete. So once you've hit that submission, so that's step 3, we move on to then a tailored process. So this is dependent on the specific service that you've requested. The next steps will be different. So once you hit submit, you should automatically, obviously give it, maybe an hour or so just in case for server problems, but you should receive an email at the email address that you provided to us in that pre-application form, which will contain your ISIDORE ID number. This is really important. You'll need to keep a record of this. And it will also provide you with a link to the full application process. So this is the full application process is then managed by the research infrastructure who is coordinating that particular category of service. So this application process will look different depending on the service that you've requested. It may be an online form, an online application process, or it may be a link to download a document which will need to be completed and then emailed back to us. So again, going back to this cell models example, this is just we won't go into detail about it, but an example of what the application form looks like. It will ask you for your ISIDORE ID number so that we can track that you have indeed completed the pre-application process and that we can monitor that your progress through the application procedure. We'll be asking for a longer abstract and description of your project. We'll be asking a number of questions relating to the ethics of your particular project and what kind of ethics approvals may be required or that you have already completed. We'll then look through some questions around the methodology of the project, your expected outcomes and impact, and details of the researchers who will be working on this project. So I think for many of you, this will look like a fairly standard application form for when you're applying for grant funding. But in this case, you're applying, as we've talked about, specifically for access to services. So as you can see, this is a longer, more detailed application form after that first application process. But having said that, this can look different depending on the specific service. When you receive that automated email, you'll also receive contact details for an email address that you can contact if you have any questions relating to this application process or you need some guidance through the process. And that will be the contact for that specific research infrastructure who's coordinating the application. So if we move on to the monkeypox call for proposals, it is a slightly different process in the fact that there is, we are not asking you to look at the catalogue of services and select a specific service. The reason for this is because the monkeypox call is a real emergency response call. So we have a deadline at the moment for pre-applications of the 5th of August. We wanted to ensure that we could roll out this call for proposals rapidly to respond to the emergency. And if we paused and took the time to put together a dedicated catalogue of services for the monkeypox call, that would have delayed us being able to get this call for proposals out quickly. So instead, what we'll be doing is asking you to give us a description of your project proposal and the types of services that you are looking for. And then it will be a slightly more consultative process, and we will discuss internally whether we have the capacity and how feasible it will be for us to provide that appropriate service, and then come back to you to provide you details of what services we are able to offer to respond to your project needs. So the application form looks identical to the SARS-CoV-2 application form, except that we do not have this first question around the specific service. The TNA topics are the monkeypox topics specifically, so they're the ones that start with MPX instead of SC. So you should go in and check that against the topics listed in the call for proposals. And then when we get to this aim of the research, we would like you to specify as much as you can what type of services you are looking for, what type of services would help you reach your research needs. And then we will use that information to consult with our project partners and to identify what services we would be able to offer, to then come back to you with a proposal for the next steps. So once you have submitted this pre-application and you've received that automated email with the link to the full application form, what happens next? So it's fairly similar process for both of them. As I mentioned with SARS-CoV-2, that email should be automated. So it should come to you almost immediately after you click that submit button with the link to complete the full application. For the monkeypox call, we ask you to give us approximately 1 week maximum for us to have the time to consult with our project partners and to come back to you with some further information. We might request further information from you, or we may be able to come back to you directly with the application form that's most appropriate for your services. We'll then ask you to complete and submit that full application. And at that point, once you've provided us with a lot of these extra details, that application will be reviewed with consideration for the technical feasibility of the service offering. So whether we have the capacity within our consortium, looking at the scientific excellence of your project, and also its adherence to the required ethical standards. This obviously varies quite widely depending on the type of service that you are requesting. The ethical standards between, for example, an imaging request through to a clinical trial are quite different. And then once it has passed this review and has been selected, it will then be assigned to one of our service providers. So as mentioned, this service provider will be selected based on, they will be the service provider who's most able to provide the service and also who exists in a country which is different to your own. Access will be either in person, remotely, or virtually. So in person will be actually that you will go to this service provider site, to this laboratory or whatever that site might be, and you use the tools and services which are provided. Remotely would be that the service provider is conducting that experiment on your behalf and in consultation with you, and then we'll send you the results. So that can often occur when the laboratory has limited access, or there's specific training which is required for you to access that laboratory. It would be a much faster process rather than for you to go through that arduous training for the service provider to conduct the experiment on your behalf. And then virtual is you will be provided with access to online services. We also, as part of the research infrastructure who is funded, and then we provide you with the free access. So as mentioned, you will not receive the funding directly yourself, but we do also within that that offer provide logistical, technological and scientific support and training if required, whatever is required to successfully access these services to help your project. So that's an overview of what happens next. There was a question in the chat earlier from Veronica regarding the timeline from that pre-application through to the access. It's really dependent. It's dependent on you, on how long it takes between that pre-application to you then submitting that full application form, which does obviously require more in-depth input. There may need to be a slight a consultation regarding the review process, depending on how complex your request is or how complex the services are that you're requesting. And then as well, service provision, it could be quite a short service provision, but could be quite a longer process of a number of weeks, depending on the specific experiments that need to take place. So not that that's helpful, it's quite a difficult question to ask, but it's because of but it's because of the range of services that we're providing and the variety of them that the timelines can vary quite drastically. Once you have completed the service, well, once we have completed the service provision, what happens with the results of your experiments and the results of your project? So you, the user, the researcher, you remain the owner of the results that you've obtained through your access to our services. You are expected to invite the access provider, the service provider, to contribute to the writing of subsequent manuscripts which are related to this service. And you should ensure that the results that you generate are disseminated. Apologies. So although you do remain the owner of those results, we are encouraging everyone to disseminate those results as much as possible, as mentioned, to really achieve these aims of increasing European and wider capacity around pandemic preparedness and response. So that's a general overview of the application process and the catalogue of services. For more information, there's a few different steps you can take. You can follow us on Twitter. We have an FAQ page on the website. You can also sign up to the newsletter that's on the website. You'll find a form to sign up to the newsletter. And we also have a contact us form, or you can just email directly to ask specific questions. This contact us email address is the very general contact email address. If you have applications, if you have questions that are about the project in general, the application processes. If you have questions about specific services, as mentioned, you'll find some contact details on those specific service pages. So that's an overview from now, and we can move to a Q&A session. So I wonder if I might stop sharing my screen for now. It's probably best so that we can move to you.
Thanks a lot, Claire. I try to plug instead of relying on Wi-Fi, so I hope that my answers to your questions will be clearer than my presentation. I very much apologize for that. I hope this was still useful. Thankfully, Claire's presentation was on my side without any technical problems. So I think it was very important you knew how to get some support from us. There are some questions that are in the chat. So I'm going to go through that. Some of them have already been answered. So for example, UK-based researchers, I hope that now Roya has answers with yes, you are eligible. And the day we are out of capacity for international researchers, we will stop accepting those applications, but that will be made clear on the website that international researchers are no longer eligible, but they are definitely eligible right now, and you're very welcome to pre-apply and then complete a full application. In terms of capacities, I see that there was a comment about from Regan Karki saying that I'm sorry, Broya, I cannot hear you. It was very metallic also on your side. I see that you have unmuted your microphone. Can you try again? Unmute again and maybe comment on what I have just said.
Hi, I just wanted to say thank you for clarifying.
Oh, so, sorry. Yeah, no worries. So again, yeah, very welcome to apply. In terms of our capacities, so there is a comment that we are very inclined to core biological and chemical experiments, which is very true. And asking if we are considering to welcome institutes that are on the system biology computational side of research. So there is something that we have not mentioned. There is also a form kind of inviting you to mention to us the type of services that you would like to see added to the catalog of services. You're very welcome to use that form and let us know the type of new services and resources that you would like to get free access to in the frame of ISIDORE. We will consider welcoming new partners to provide those new resources to scientific communities. So we will make a note of your comments, of course, but if you can also make it more formal through the website, we would be very grateful. I'm gonna continue. So in terms, I think you have already mentioned timelines. Claire, can you confirm?
Yes, so just saying that in terms of those timelines, it is very variable depending on the service that is requested and the procedures that might need to be taken in terms of reviews, potential ethics processes, and the actual service provision. It's quite variable. I don't know if Audrey, you have a more specific timelines that you can provide on that.
No, what you say is correct. So typically, if you are requesting free access to something like in the field of structural biology or maybe also imaging, this is typically something that would be a fairly fast access, can be done within weeks. If you do require access for a more complex in vitro and more specifically in vivo study, for sure, we are more like aiming for a couple months to even like several months for that to be completely finished. This will definitely take more time to implement an in vivo study, for example, due to, as Claire mentioned, some ethical clearance that will be required, and also just even performing the experiment will be also longer. So due to the range of services that we offer, is very difficult for us to be specific about timelines. But when you do, yeah, sorry, go ahead.
I was just going to say, just to add to that for Veronica, depending on the specific service that you are interested in, you could also contact the contact point on that specific service who would be able to probably give you a more accurate prediction of timelines.
Thank you. About our future actions, I see some curiosity as to where we stand with regard to influenza viruses. Those are definitely going to be included in the next calls for proposal in the respiratory disease with pandemic potential categories. So yes, there will be some action including influenza, as we know there is, and actually that's what people were expecting for the next big pandemic. In the end, it was a corona, but influenza is still of great interest and of concern, let's say. Then I'm gonna be going a bit further in the chat. Again, for Roya, just in case, so I was very specific about international applicants, but you can also apply as a group, not coming from the same country. You will just need to identify a principal investigator as in any other application. So one institution will be carrying the project for the group. Then I see a question from Garino. I don't see the full name. I'm sorry about that. Does ISIDORE funds only the specific services or project in its all, including pieces of research that can be done in the applicant's institution? So what we cover is the performance of specific services. If you do need So it was Girino Makori, sorry about that. If you do need several services in your project, you're very welcome to contact us and we can guide you for application to multiple services. But overall, we're not funding research that will be done at your own institution. So there are some elements of your project that we cannot cover. The ISIDORE project is really meant to give you access to very specific things that you usually do not have access to. So this is how that type of, that support mechanism is different from the usual funding model. This is really about performing science that you usually cannot perform yourself or locally, at least with some local or national collaboration, let's say. I hope my answer is clear enough.
Yes, Gurino said in the chat that that was clear. Thank you.
Yeah,
Okay.
thank you, Audrey. Very clear. Yeah, thank you very much.
Okay, great. The service related to clinical trials for Sophia. So we are in the pool of research infrastructure that we have gathered. We have ECRIN, the European research infrastructure that is dedicated to clinical trials. So they have made possible for us to be connected to the current adaptive platform trials for COVID-19. So what it means is that we, of course, we will not be able to support full clinical trials, but what we can support is the implementation of a new intervention arm in an existing European clinical trial. So there is a very specific mechanism for access to the clinical trials that are dedicated to therapeutics. So we are relying on that mechanism for the selection of the project that may get access to that. So this will be, of course, very selective. We cannot, we will rely on the opinion and the recommendation of the board that is currently in place for making that type of decision. But we are talking about the RECOVER trial, and I think we have listed them all on the website in the relevant service category. Is that clear enough, Sophia, or do you want to unmute your microphone and comment on this?
Thank you, this is clear.
Okay, great. Thank you. Then I think that for the question from Pascal Mertens, we have clarified that the scientists, if it is a group applying, remain the owner of the results. So for exploitation, for example, by an SME, you do not need to pay some license fee for that exploitation, and SMEs are not under the obligation to disseminate. If they have the possibility to do it, that's great, but they are not under the same obligation as researchers and scientists from the public sector. So then there is a question from Lauro. To what extent do you assess whether a service is not available in the country of origin of the applicants? So most of the application procedures do request you to describe the gaps in your own research environment. So we are relying on you explaining to us your needs for access. So this is like a trust-based type of information, I would say. Then I see another question from Royad is kind of related to the previous one. What if the technology or research infrastructure we want to use? So what if it is available in our country, but access to it for the project is not due to lack of funding or training? Could we then qualify to apply? So this is a tricky one. Definitely, if it is in your own institution that is not eligible, we cannot help you get access to capacities that exist in your own institution. For other institutions in your country, we would still have to really assess your needs. The ISIDORE project is not meant to substitute for national support. So the transnational access, the transnational requirement is fairly important. There might be cases where the capacities are so unique, it might be considered, but it will be more like I have been fairly positive about my answers so far. In that case, that would be more like based on a case-by-case basis, if that makes any sense. I think, so can you please let me know if I missed anything. So the scrolling down the chat is not necessarily always the best to see all the content. I see.
From
Okay.
my side, that's all of them, and we've just had 2 new ones.
Okay, I see who's got the
Back.
proposals. It depends on the research infrastructures, but the evaluation is based on an independent peer review type of process. So there would be scientists and experts that do not belong to the research infrastructure that is meant to provide the support to the scientist that has applied. But it will be a variety of people, because as you can tell, we have a lot of different services, so we need a lot of different expertise to be able to evaluate all those proposals. So we have a fairly wide, let's say, evaluation panel. Then there is another question from Veronica. So at which point would the potential service provider be involved? Only after the approval from ISIDORE or before that? I'm asking. From the perspective of a biobank who potentially provides clinical samples, we do also have an access process to follow that includes, for example, sorry, I'm kind of scrolling too fast, that samples are not allowed to be given out without ethics vote. So yeah, for that, this is related to the infrastructures that you're related to. I assume you're talking about BBMRI. BBMRI is in charge of the provision of clinical samples to scientists. That would mean that they are complying with their regular access procedures. So there is no, ISIDORE is not trying to change anything at the level of the access of the different ISIDORE partner facilities, what we call the service and access providers. We have no authority to make you change any of that. So of course, if there are some ethical requirements at your level to be able to provide access to your samples, they will have to be complied with, including in the frame of ISIDORE. Lauro is asking if we have received any applications so far. Yeah, absolutely. The calls for proposal, the first call for proposal launched about a month ago. We have received a very good number of pre-application and now full application also coming. Yes. If you want some support, you need to hurry. If you do want to unmute your microphone, you can also do that. Sorry for interrupting, Claire. Please go ahead.
No, don't worry. I was going to say the exact same thing. So I think that's all the questions that were written in the chat. Oh no, we have one more. Are there any networking opportunities to form new collaborations? I can take that one if you like, Audrey. But
sure.
At the moment, nothing is set, but definitely keep an eye on our Twitter and the website in case opportunities come up. And you're also welcome to identify collaboration opportunities amongst, for example, if you see someone on this webinar who is of interest to partner up with, but we'll keep you updated as anything regarding networking opportunities becomes available.
Any other question? again, you don't have to write in the chat. If you want to simply unmute and take the floor, you're welcome to do so. Well, just also to maybe like add to what Claire just said in the context of getting some support from ISIDORE if you are selected, and then you do get some free access to some of our services, at least one of them. You may end up working as if you were in a regular collaboration. There is no specific, we're not making service provision any more formal or anything like that. You will then be working with some of your scientific peers, so you can also consider that you are already building a new collaboration through that. And the ISIDORE project is taking care of covering the costs of that collaboration, basically. Anything else? Maybe that was way too much information. Hopefully
we just
not.
covered everything so well.
Maybe. Well, there was a few. There were a few questions, very legit ones. Hope it was useful. As Diana and Dylan, who are in charge of ISIDORE communication from Arenia, the slides, the content of the presentation will be made available on the website. There will be also other installments of those webinars, so maybe you're not the right audience that should inform of that because you have already attended one. But if my equipment gets better, maybe you will hear everything that I say next time. That would be good. I really think that the fact that we recorded today was a bit useless due to that, so we will record again and make it available. So can we ask for a service that is currently in one section for a need in another section? Not sure. I'm not sure I completely understand the question, Pascal. So to me, the question or the section, sorry, are related to the research topics. So your research project can fit for sure with several topics to some extent. We'll ask you to choose the most relevant one. Service categories, they are not we do not expect them to answer necessarily like very specific topics. We do expect you to have needs in certain services, regardless of the T&E topics that you have chosen, except for the clinical ones. So the clinical ones, the clinical research topics are very much linked to the clinical services, but other than that, you can mix and match as required. I don't know if that answers your question. If you want to unmute your microphone and give me an example, I'd be happy to clarify further. Okay, apparently that was good enough, great. Anything else? If there is nothing else, we can close the webinar a little bit earlier than what was expected. We were not exactly sure how many questions you would have had, so we had planned for an hour and a half with basically a bit less than 1 hour of presentation and about 30 minutes of questions. I think that Claire and I have presented in significantly less than 1 hour, so we've been answering questions for quite some time now. If it is what you have for now, I think we can consider closing the webinar. Claire, what do you think?
Yep, I think that sounds good. And just to say as well, if I just share my screen for 1 minute, just a reminder to everyone to follow us on Twitter, and that's where you'll get the most updates, especially around the upcoming new calls for proposals after the summer, and also just a reminder of the website link and the contact email address, which you can follow up with us for any further questions.
Okay, perfect. Well, thank you very much for everybody that attended. I hope that you now know more about that big project that ISIDORE is. We are really looking forward to supporting your project and your research on infectious diseases. And yeah, keep in touch, and also stay informed about the next webinars that will be more dedicated to specific categories of services. You will learn even more about the capacities that we can provide to you. So thank you very much, and we hope to be receiving your applications very, very soon.
Thank you, everyone.
Bye, everybody.
Bye.
Thanks. Bye.
Thank you. Bye-bye.
Bye. I turned my camera on again. I hope the sound is still okay. Claire?
Yeah, it's fine
Is it
now.
still fine?